Everyone, and today I welcome all the prestigious guests from across the world and on a Saturday morning. Thank you so much for joining us today. This is the sequence of events that we will be following. This has been shared with the panelists as well. We will start with the name of Allah by Mr. Umair Essen. So we'll begin from there and then we'll go forward as we go along. I'll request Mr. Umair Essen to please recite the holy verses from the Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وقضى ربك ألا تعبدوا إلا إياه وبالوالدين إحسانا إما يبلغن عندك الكبر أحدهما أو كلاهما فلا تقل لهما أف ولا تنهرهما وقل لهما قولا كريما. Translation. And your Lord has decreed that you not worship except Him, and to parents do good treatment, whether one or both of them reach old age. While with you, say not to them so much as fie, oof, and do not repel them, but speak to them with respect. तर्जुमा. और तुम्हारे परवरदिगार ने इरशाद फरमाया कि उसके सिवा किसी की इबादत ना करो और माँ बाप के साथ भलाई करते रहो। अगर इनमें से एक या दोनों तुम्हारे सामने बुढ़ापे को पहुंच जाएं, तो उनको उफ तक ना कहना और ना उन्हें झड़कना और उनसे बात अदब के साथ करना। सदक़ल्लाहुल अज़ीम।
Jazakallah. Thank you so much, Umair. Now I would like to introduce my distinguished panelists. I would like to inform everyone that the session chairs today are Professor Muwaddat Rana and Professor Asad Nizami. Our panelists include Mr. Riaz Fatiana, who is MNA, Governor SDGs Task Force, Member Parliament of Pakistan. He's a psychologist at Human Rights Activist, Chairman Parliament Standing Committee of Law and Justice. We have amongst us Ms. Sidra Imran, Member Provincial Assembly, MPSN. We also have amongst us Brigadier Professor Muwaddat Rana, Consultant Psychiatrist, Chief Editor, Journal Pakistan Psychiatry Society. We have Professor Asad Nizami, who is a Professor of Psychiatry, Chairman Institute of Psychiatry, Rawalpindi Medical University, Rawalpindi. We have Professor Ira Leroy, who is Associate Professor of Geriatrics Psychiatry from Trinity College, Dublin. We have Professor Saima Dawood with us, who is Director of Central of Clinical Psychology, University of Punjab, Lahore. We have Brigadier Retired Munawwar Ahmed, who is President Alzheimer's Pakistan, Rawalpindi chapter. We have Dr. Khatija Azhar, Public Health Consultant, Shifa Foundation, Rawalpindi Medical College. We have Major Retired Mia Abdul Basit, General Secretary, Alzheimer's Pakistan, Rawalpindi chapter. We have Mr. Hussain Jafri, who is Secretary General, Alzheimer's, Lahore, Pakistan. Amongst us, we have Dr. Shujat Farooq, Senior Research Economist, Pakistan Institute of Development Economics, PIDE, PhD in Developmental Economics. Mr. Muhammad Arshad, Director Technical Sehat Sahulat Program, who are the banners of our government program also. Mr. Mia Tikur Rahman, who is Project Director and Founder, Welfare Hand. Project Director, Hamza Foundation Welfare Hospital from Peshawar. We have amongst us Dr. Amjad Chaudhary, Consultant Psychiatrist at Fountain House, Lahore. He's our Global Trainer of Addiction Training, of Teaching, Training and Development in Pakistan Institute of Living and Learning. Amongst us, we have Dr. Sadia Seem, who is a Research Fellow at University of Manchester and Manager Roshni 2, South Cumbria NHS Foundation Trust. Last but not the least, we have Mr. Ubaidur Rahman, who is Chief Executive Officer. He is a digital at a digital agency. He's the media rep today amongst us. These are the panelists that we have today for our session. Nevertheless, we have lots of research assistants and research associates and psychologists from across the globe who are participating today with carers and audience amongst us. So I welcome you all and I thank you for taking out time today for us for this prestigious moment. We will begin. I will request Professor Naseem Chaudhary, Chief Executive Officer at Pakistan Institute of Living and Learning, to please begin with the session. Thank you so much, ma'am.
Thank you, Sameer. Assalamu alaikum, everybody, and a very warm welcome. It's so heartening to see, mashallah, the mix and the experts in the panel that we have. I just wanted to add that Dr. Amjad Chaudhary is also a panelist, but he's also a carer. So he's in two capacities. I want to, first of all, shout out a big thank you to Mr. Riaz Patiana, who's the MNA and Chair Parliamentary Task Force. He's been instrumental in taking this work forward. He's been with us from the very beginning, and he's leading this work from the Parliament as well. This is our second event on health and well-being of older adults. So those of you who were not present on the first event, I just very want to quickly give you a recap. हमारा first event हुआ था Pakistan Mental Health Summit में. This summit was organized by Pakistan Institute of Living and Learning, Mr. Riaz Patiana and his team, and the University of Manchester. It was held in March 2020, this year. It was hosted by the President of Pakistan, Honorable Mr. Dr. Arif Alvi. At the President House, we had our inaugural session. And during that session, we were tasked to develop the National Mental Health Strategy and its implementation plan for 2020 to 2030. Now, this will also help Pakistan achieve its SDGs. After the summit inaugural session, we then met at the Pakistan Institute of Parliamentary Services for our first event on health and well-being of older adults. Now we know that all United Nations countries have recognized the SDG plan for sustainable human development by the end of year 2030. Pakistan has also signed up to it. And mental health and well-being include hui hai SDG 3 mein. We know that social factors directly contribute to mental health outcomes. Social determinants like relationship issues, migration, poverty, and many others are directly linked with not just prevalence, but also severity of mental disorders. और हमें अब ये भी पता है कि 13 out of these 17 SDGs are linked with mental health. Can we have the next slide, please, Sameer? हम अपने इस काम के लिए we've taken a life course approach. So preconception, pregnancy, postnatal, early childhood, young adults, working adults, and older adults, जिसके लिए ये group है जो आज हम मिल रहे हैं. Next slide, please. From our first event, things that came out in terms of जो लोगों ने problems identify की, some of these were issues around older adults being lonely, bereavement issues, their loss of role, उनकी cognitive decreasing ability, hearing and visual impairments, financial constraints, and the limited evidence of research in Pakistan on the older adult mental health. और जो challenges, especially dementia se related the, these were around getting ethical approvals, interviewing people with dementia, issues around qualitative research, and generally research acceptance within the communities. Next slide, please. Solutions we suggest doing, looking at prevention strategies, getting our younger generation involved, caregivers ki training, especially female caregivers, having multidisciplinary specialized memory clinics, dementia policy, and a campaign for dementia at national level. Next slide, please. When we look at the social determinants, SDGs, and mental health, work done by Lund et al. Is extremely useful because they've looked at these social determinants and they've developed a conceptual framework. Next slide. So what they've done, they've divided these determinants, social determinants, in 5 domains: demographic, economic, neighborhood, environmental, social and cultural, or they have aligned those to relevant SDGs. Lund in his work has not included any work from Pakistan. So we've taken this initiative to develop the research evidence for these, so we can understand these social determinants and its implications within the Pakistani concept. हमने एक अब किया है कि we've started systematic reviews on these various domains, and today you are going to hear some of the preliminary findings. So I'm not going to keep you any longer so that we move on with our agenda. Thank you again, everybody, for contributing. Thanks a lot. That's fine, Samin. Thank you. Back to you.
Thank you so much, ma'am. Thank you so much, ma'am. We'd like to now share a bit of highlights from our previous. So, please share the video with us.
उनको मेरे पे करा दें.
Thank you. Now I would like to request Mr. Riaz Fatiana to please address the audience with his welcome note. Mr. Riaz Fatiana.
Thank you. I'm grateful.
Riaz Sahab, you are on mute. You are on mute.
Mute. Now you can listen to me. Hello?
Yeah, we can hear you now.
Sure, thank you. I'm grateful that everyone is here, like Professor Nusrat, Professor Naseem Chaudhary, Mr. Umair, Mr. Mahim, my old friend Modad Rana, Mohsen Hassan Alvi Sahib, Shajat Farooq, Sehresh, Majid, Asad Nizami Sahib, Maria, Professor Leroy, and Mr. Sidra, Miss Sidra, and Majid, Mr. Majid. If you remember, we were together in the month of, perhaps that was 2019, when we met in London in collaboration with Manchester University. That was a wonderful event organized by Professor Nusrat. Secondly, we met at the President House, and now we are again on Zoom meeting. Look, mental health is a prime importance in the present scenario of COVID-19. if you remember in start, many persons who were shifted from homes to hospitals due to coronavirus mostly were expired. Why? Because there was atmosphere of fear. There was atmosphere was stress and anxiety. They were deprived to meet with their family and their children and their society. Everyone was in panic, and mostly people die in hospitals due to mental stress. Now, when the government allow Pakistani people to, they can stay in their homes and they can get treatment with the help of their members of family and friends. The result was different. And very smartly, government Pakistan announced smart lockdown, and later on it gradually eliminate. And we started whole functions of our industry, shops, everything. And we were able to reduce COVID-19 in Pakistan. This reflects that mental health, stress level, anxiety, and fear are major key roles who can determine how we can control a menace, COVID-19 or other things, or how we can send our patient, our loved one to on the mercy of only doctors that in controlled and in different atmosphere. Secondly, there was another law that if somebody tried to suicide and he survived, that then police will capture him. I especially moved amendment in present law that rather than to send the person to police station, he should be shifted to some community center to establish, to strengthen his willpower and his confidence level. The bill is still under process in the parliament. Secondly, there are mental health act at Punjab and in Punjab and KPK that unfortunately we haven't at federal level. Again, we moved a bill in National Assembly and government is also on board. Hope due to some kind of confrontation in between government and opposition, we are very slow in legislation. I hope with the passage of time, we will be able to pass that bill as well. Thirdly, there is need to become on one page, like a psychologist, psychiatrist, academia, parliamentarians, bureaucracy, every media person, everyone should be on one page. Said that if you remember, there was another case of rape on motorway that was a shameful act by some people who were captured later on. But missing part is trauma counseling. There is need to establish a special mechanism for trauma counseling in the state of suicide or rape or murder or terrorist activities or bomb blast, etc. So we can give some kind of counseling to children, women, and old elderly people, how they can return to normal life. And anyhow, I am available. Pakistan Parliament is available. I am chairing National Assembly Standing Committee on Law and Justice, as well as National Parliamentary Task Force on Sustainable Development Goals. So goal 3, like good health and mental health, is very important. We are on board, and I assure you all people, you my friends, that Parliament of Pakistan and government will stay behind you if you give us some concrete proposal. Thank you. Thank you.
Thank you so much, Mr. Raswatiana. Thank you so much for your kind words and your precious time with us today. We would now begin with our formal presentations. I would now request Ms. Maham Rashid, Research Associate, Pakistan Institute of Living and Learning, to please present her preliminary research.
Thank you, Ms. Amin. Bismillahirrahmanirrahim. I will begin my talk about the demographic risk factors. of Older Adults in Pakistan and how it helps to achieve sustainable development goals. As we all know that in this life course, increased age is associated with the specific pattern of mental disorders. But here, it is important to know how demographic factors such as ethnicity, age, gender, and sex has become the risk factors of developing mental health disorders among older adults. Although it is thought to be as a protective factor, such as when you get older, you become wiser, and how we can prevent it while directly achieving the Sustainable Development Goal 3, which is good health and well-being, and the other Sustainable Development Goal 5, which is about gender equality. We have started to do a systematic review on the domain of older adults. We are focusing on demographic risk factors along with the potential effective interventions. Next, please. In this process, we run search strategy and found 158 total screenings, in which 143 articles were excluded at the stage of title and abstract screenings. Total 15 articles were mainly related to the demographic risk factors and potential interventions of older adults, which is again related to demographic factors. The excluded articles were mainly not related to Pakistan. Some are duplicate studies, some were focused on qualitative research methodology, which is basically our exclusion criteria of systematic review. Next, please. Here is the main findings, in which we found that 13 studies were mainly related to the risk factors of developing depression among older adults, in which 3 studies showed that being woman is a risk factor in older age for developing depression. The result of other 3 studies also showed that being single or not living with spouse is also a risk factor of developing depression. Plus, increasing age is itself a risk factor of depression, which has been proven in 7 studies of Pakistan. Furthermore, one study also showed about the death anxiety, which is more found in unmarried elderly instead of widows or married elderly population. Now, the last and very important finding is about executive functioning, in which it reveals that gender, marital status, and functional formal education are associated with cognitive, emotional, and behavior difficulties. Thank you. Thank you, Ms. Amin. Thank you all.
Thank you, Maham. Professor Muwaddat Rana, I would now request you to please chair the discussion session for this particular domain, sir. Sir, I would request you to please unmute your mic. Thank you, sir.
Bismillahirrahmanirrahim. Thank you very much for asking me to chair the session. I'm particularly grateful to Mr. Riaz Fatana, who's a constant source of inspiration and support for all of us as mental health professionals, but also look up to him in his capacity as a legislator in Pakistan with a deep interest in mental health services of the country. His support in the last 2 years in particular through the Forum of PIL has been even more inspirational. And to follow up on the initiative that started the presidency last year shows that he's been earlier part of the year shows that he's following up on his commitment with the mental health services in Pakistan and their development, as well as on making it into a policy issue around the country. Now, the couple of points that I particularly expect our discussants to focus on are based on 2 observations as a mental health professional engaged in the not only at the Forum of Alzheimer's Pakistan, but as a practitioner at a clinical level and looking at old age patients and their families. The first is that we are primarily a country or a culture which has a deep commitment and intent towards taking care of our elderly. As a culture, both in terms of thousands of years of the Indus Valley civilization that we belong to, and the Islamic culture that prevails in Pakistan. At both those levels, the intent to take care of our elderly is huge and has been traditionally present all through. Yet, the services that are provided by the families primarily are not recognized, number one. Two, these services are never researched. And three, that it is provided by people with tremendous positivity and intent, but hardly any training in how to look after a person with challenges of the old age, particularly if the dementia has set in. So if we can start by discussing these gaps, that the intent is there, the institutional commitment of the family is there, the huge tradition of care that is available to us, but the gap that exists in terms of training. Second is that there are large number of evidence-based interventions now available from around the world. But those interventions, since there's no training of the people who are looking after their elderly primarily at a personal level, there is a disconnect between those scientific materials that are available in terms of provision of care, not reaching to the families. So it's scientists who are engaged in dementia care talking to each other. So we are preaching the choir all the time. So their wonderful ideas are not reaching the people who can really consume and look after. That's a very Western model, because there, of course, the mental health professionals engaged in dementia care can reach to the old age homes, the hospitals, the hospices, etc., etc. But families are who are looking after the elderly are unreached populations. So wonderful interventions, scientific data, but not reaching the family. Those are two major challenges that I'd recommend that we talk about in our discussion from here on. Over to the discussants. G, please. Our discussants really to now take it from here on and give their thoughts and ideas.
How do we go about? I am a panelist, so I'm remaining quiet. I thought somebody else takes the lead, or if people don't, then I can always speak up.
Anyone who's got any suggestions and ideas on what Professor Muwaddat has suggested is free to sort of raise their hand and share their thoughts.
Okay, I've already raised my hand. I'll be very short because I've seen the timetable. I think it's a short, and I would want the others to contribute more. But I think Professor Muwaddat is absolutely right. Most of the researches, when we start exploring, are being done by clinicians, and they have a clinical mindset. So if you look into most of those studies, you would find very few coming from the community. And that's what Professor Muwaddat is stressing, that when we work into academic institutions and tertiary care hospitals, we are providing the help, or we are providing the awareness to a very small section, because they're the ones who are coming to us. What about those who are in the community and not being looked after? The other aspect is that if you look at your life cycle approach, we have huge investments into the child and adolescent mental health. The adults we are already engaged with, so we're putting a lot of effort. But when it comes to the elderly, and I don't use the word of older, I use the word of elderly mental health, the population would not like to invest, because they think that this possibly is a population who may not be of any use to them. It's a blessing that we have a culture that we are looking after our parents. But then now in our structure also, the culture is changing. When people come, and once I've seen the elderly father or the mother, the family comes into my room and they're saying, do you have a capacity to keep them in your hospital? And I tell them, look, this is an acute unit. I would provide you our facilities in the community. And then they come back and they say, okay, Dr. Shah, what? We do not have any facilities in the community. I know we have got Alzheimer's Pakistan on board with us. We give them those booklets, we give them everything, but still I believe there's a huge, huge scarcity. The services that should be provided to the people, to the common people, knowing about what problems can occur in the elderly in the community, are still lacking. I think our strategies have to be devised accordingly, not just based on institutions and not just based on academic institutions or tertiary care hospitals. So I would like the others to give their viewpoint too. Thank you.
May I request Professor Erisima Leroy, she's been the architect of the roadmap for dementia, particularly from Pakistani perspective, and has been a true soldier working alongside us on this issue, to throw some light and her ideas on the themes that we've been identifying in this discussion. Professor Leroy.
Thanks very much, Professor Rana. I'm honored to be here, and thank you for calling on me. Yes, I'm listening to this. It's going through my mind the kinds of themes that came out of our roadmap, which I hope to touch on at the end of this forum. And I think some of the key issues are, number one, that the solutions have to be appropriate to the local context. However, that doesn't mean, I don't think, reinventing the wheel entirely from scratch. I don't think there's time to do that. That would take 25 years. So it's about taking the learnings from overseas, where older adult care, particularly for mental health, has progressed quite well, and adapting those, and I think accelerating the trajectory from proof of principle to implementation. So if we go back to the very beginning and start reinventing everything from scratch, I think it'll take too long. So what that really means is looking around, exactly like we're doing in this forum. What is the best evidence from elsewhere, but then adapting it and seeing how it can be used here. And I think in our research roadmap, we try to address that by saying that when we bring ideas from overseas, things that have worked, things that have a good evidence base, we have to integrate them and involve people on the ground. And by that, I don't mean clinicians and researchers, exactly as the point was made, but the people living with the condition, carers, through the process of patient and public involvement, to understand how will this work in this context, and then move fairly rapidly from feasibility and adaptation into implementation. And I think that's one of the keys, is that the focus on implementation research needs to be brought in here. How will this thing work in its adapted version in the current context? And that's a big challenge, not just here, but everywhere.
Thank you very much, Professor Leroy, for identifying. If I may just add and ask for a supplementary comment from you, I can assure you that the models of care that families in Pakistan use in the care of their elderly are sometimes most innovative and interesting, actually. So I personally believe that while we can learn a lot from the West in terms of flow of data and information coming from there, in terms of evidence base, in terms of methods, new techniques that have come in, including medication and all the rest of it, Pakistan and South Asia in general has a lot to share with the rest of the world in terms of a bilateral flow. And this roadmap that we're talking about, once this road is made, Pakistan is making all kinds of roads these days, particularly with China. But you know, in this particular kind of road that we are planning, it will be a bilateral flow, and there's a lot that that we can show to the West. It's just that our practices and our interventions and the methods that are used so innovatively with minimal resources, absolutely minimal resources by families, can serve as possible models for the West as well. So that's a kind of a thought that I'd request Mr. Hussain Jafri from Alzheimer's Pakistan to say a few words on that, followed by our president of Alzheimer's Pakistan Rawalpindi chapter, Brigadier Munawwar Rana. Over to you, Jafri Saab.
Thank you, Professor Rana. I'm grateful for the opportunity. I think I'll start with the training that you discussed earlier on. That I think there's an issue with the training program, and what we as family caregivers have also experienced, that there is a problem of diagnosis, with the lack of understanding at the level of the healthcare providers, and somehow the other, I think the dementia has been categorized as a medicalized sort of a problem, where we have very little medical help that we can provide to the person with dementia. So I think we need to take that out, and we need to understand the sort of the solutions that are possible to provide relief to the family as well as to the person with dementia. Then the training, as you said, there's another issue with the training of the care providers, because as majority of the doctors do not really understand dementia, the families, they have really no idea what dementia is and how to look after a person with dementia, and since they don't have an idea, I think we experience a lot of psychosocial and family problems because of those issues, because then these people with dementia are then categorized as mad people and all the sort of stuff. Then I think there's another issue of like, yeah, society as a whole, there's a mindset, you know, when we start, we provide the service of like daycare center, then, you know, there is still, you know, although we have started this service about more than 10 years ago, but there's still a different mindset in the society whereby the carers, you know, one of them would say, well, it is my job, and you know, nobody else can look after him, and you know, I should be the one, you know, doing this caregiving myself. And then there is other mindset that, you know, what is going to be said by other people, that, you know, we send them to a daycare center or something, and so we can't look after our loved one. So I think there is a lot that needs to be done at the level of the community as well, for creating awareness about these issues and what sort of services. And as previously been, you know, I think said by somebody, perhaps it's about the neglect of the family. I think that's also another issue, because once there are no formalized services available, then, you know, if you know, in our society, many of these people with dementia are also neglected by the family. So we need to, you know, have a program whereby we can create understanding about disease and awareness about the disease. So considering this, as WHO has about 2 years ago, they come up with national dementia plans. Following up on that, we have developed a national dementia policy draft that even Professor Larai has given her input into that. That is ready. We have already discussed this with the government of Punjab. The health department is ready for that. I've also discussed it with Dr. Faisal Sultan at the federal level. So it was ready by the, you know, at the beginning of this year, but because of COVID, it all stopped. But now I think
I'm really sorry, sir. We are conscious of time. If you could just keep it a bit short, and maybe we could.
I'm just wrapping up.
I'm really sorry, sir. My apologies.
No, it's okay. So that policy is already there. So hopefully, you know, very soon either we'll get it launched by the federal government, by the president or somebody. So if there is some you know, delay at that time, we will get it launched by the provincial government. The provincial health department has already given its blessing that they will have a complete PC1 on that. So that's a big progress as far as the dementia is concerned. Thank you for the opportunity.
Thank you so much, Mr.
Could we request Navar to add anything else that he would like to, as the president of the Rawalpindi chapter of Alzheimer's Pakistan? Brigadier Munawar, are you there?
Muwaddad, Professor Asghar Zaidi also wanted to comment.
Ji, please, Professor. Most welcome.
Ji, thank you so much. I think most of the things that I wish to raise have already been mentioned by Leroy and Hussain Jaffrey. But one or two things, and this is coming from a very rigorous research we did with Alzheimer's research, with the help of Alzheimer's research, and in which we interviewed the patients with mild dementia. We interviewed their caregivers. We had focus group discussion with the community persons, and we also had interviews with the key stakeholders. Two things that stood out. One of the biggest stress factor for patients as well as for caregivers has been that they were unaware of the fact that people with mental disorders were exempted from religious duties. And I think that's where the interventions are necessary, either from Alzheimer's Pakistan or from other such national level organizations that can raise awareness. Then, Dr. Rana, you raised a very relevant point that we keep talking amongst the converts, and we need to go beyond. And one of the models that I was discussing with Hussain Jafri is that to provide information and equip them and train lady health workers who often go house to house, perhaps for a different reason, but they can also keep an eye to see if there is an elderly in the family, and awareness could be raised. One last point, and I know I wanted to be brief, but one last point. There is often a monopoly amongst the GPs that they don't let the patients go to the secondary or tertiary care. And they just hold on to the patient saying, oh, well, this happens when you get older. And the same people, even at the early stages of the onset of dementia, they are not referred to any secondary or tertiary care. And that leads to the fact that often they come in contact with tertiary care when it's almost too late. So something needs to be done at that level as well. The GPs are trained so that they could pass on to specialized care any patients that they come into contact, especially those who have mild early onset of dementia.
Thank you very much. That's most useful, Professor. We're very lucky to have legislators in our ranks today. And so I was wondering if any of our legislators, health being a provincial subject now, largely in most of its domains, would like to comment on how policy shifts can take place and help us deal with this issue at a more formal level from the governmental side. Any of our legislators in our ranks today?
Professor Muwaddat, if you could please allow, maybe have this discussion after the next presentation, sir, because we are running behind our time, sir.
Okay, most
if
welcome.
it's okay with you, sir. Thank you so much, sir. Thank you so much. I would now request Mr. Mohsin Hassan Alvi, health economist at Pakistan Institute of Living and Learning, to please present his part of the domain. Mr. Mohsin.
Thank you very much. My name is Mohsin Alvi, and today I'm going to present a systematic review, and it's based on the Sustainable Development Goals. And the title of the review is Economic Determinants of Mental Health Problems Among Older Adults in Pakistan. Next, please. This review is based on the 5 Sustainable Development Goals, and it includes the poverty. The next is the zero hunger. The third is the decent work and economic growth. It refers to the employment status of a person. The next is industry, innovation and infrastructure. It refers to the industrial revolution and the transformation. The last is reduce inequality in terms of monetary aspect. The question of the review is what are the economic factors that will lead to the mental health issues, and is there any intervention available in the market who will help to cope up those mental health illnesses? Next, please. The left box shows the economic factors. This may include income security, debts, assets, food security, employment, and so on. These key economic factors are one of the leading causes to bring these mental health outcomes that are mentioned in the right side block. Includes depression, anxiety, substance abuse, psychosis, suicides, and so on and so forth. These key factors were used in the different electronic data search base, and we have got the results from them. Next, please. 882 records we have obtained from the search, and after these records, the duplicate records were removed, and 691 records were screened, and after screening of title and the abstract, we have included only 4 abstracts in the review. Next, please. An attempt was made in Pakistan that shows no significant association of economic activities like going out for earning, on mental illness, especially depression and anxiety. Another evidence was found that indicates the average monthly cost expenditure is around 3,133 Pakistani rupees of older adults suffering with depression in Pakistan. Besides this, an intervention was also suggested that refers if older people help each other, so this may incur very negligible cost, and this is also beneficial for the society in economic and social perspective. Finally, a way forward was proposed that highlights the cost effectiveness interventions and health economics evaluation along with the utilization of the resource economically are one of the principles to implement and promote the dementia research in Pakistan. Next, please. And this is the end of my presentation. Thank you very much.
Thank you so much, Mohsin. I would now request Dr. Shujaz Farooq, Senior Research Economist at Pakistan Institute Development Economics, to please lead this discussion.
Thank you very much, respected Chair, ladies and gentlemen. Assalamu alaikum and welcome. Thanks, Mohsen, for making a good presentation by exploring the economic determinants of mental health problems among the older workers and linking it with SDGs. So I have two sorts of comments and suggestions. A few comments on this presentation of Mohsen, and I will place a few comments and suggestions to this forum as a way forward. So Mohsen, I hope that you will finalize this research and you will make a good report. So I have few suggestions. That first, you may add the definition of older adults, because you are doing the analysis of older adults. Second, you know that you have conducted certain data. So I think it is the primary data. So whenever you conduct the primary data, then you have to look at whether the data is conducted from entire Pakistan or it is conducted from a certain particular audience. So then you may call it a case study, or you may generalize the results at Pakistan level. Then you have quoted various studies at the last slide. So I was thinking that most of the literature that you have quoted is outdated. It also suggests that there is very limited research in this area. You may also add the sampling details and methodology, that how you are measuring this mental health. As I mentioned earlier, that there is limited research in Pakistan. So pill may lead, and we may suggest certain economic interventions and social interventions, like, you know, that there are cash transfers, there are microfinance, etc. So there could be certain randomized control trial type experiments. We can do certain interventions, and we can link the impact of various social economic interventions on the mental health. You know that recently there is a huge inflation in Pakistan, particularly the food inflation, and it has massively affected the poor and middle class people. So you may add these things in your reports, and you may also explore certain national data sets to build a stronger case, like demographic health survey, labor force survey, where you can link this mental health with certain demographic issues, with labor force participation, etc., etc. Now I have some general suggestions and some questions that I want to place on this forum, because I hope that this forum will develop certain policies on mental health. So first, I was looking the literature on Pakistan. There is very limited literature. There is very limited research, and one limited reason of this research is the limited data availability. So pill, and we should make the effort that we should add certain modules and questions on mental health in our national data sets, like mixed multiple indicator cluster survey, HIES, DHS. Second, we should also involve the academic in the research. Right now, there is very limited research. So academic may help us in building certain good case studies that can be helpful to designing certain policies. Second, we have good facility as compared to our forefathers. Like we have cars, we have good rooms, we have good food. But especially in cities, we lack layer. There is rapid urbanization in Pakistan. So, and planners are ignoring the factors that can help in reducing mental health. For example, look at especially smart towns. We don't have libraries, we don't have parks, we don't have recreation activities. So when we talk on SDGs goals and urbanizations and city plannings, we should care that we should create the opportunities that can help in improving the mental health. Third, despite of having good facilities, if we look our surrounding, we are creating mental stress rather than relief. For example, look at media, social media. In last few months, I have interacted with various old age population during COVID-19, and they are very highly stressed. कल मैं एक lady के पास बुजुर्ग lady पे बैठा हुआ था तो कहते क़यामत आ रही है वगैरह वगैरह. So unfortunately, we don't have the mechanism that how we can handle this stress. So we should explore the factors that how we can handle this stress, and they should be documented in policy. Fourth, we all aim to give a good education and health life to our children, but still we are not teaching our children that how to deal with stress. So I suggest that this is the time that we should introduce a civic life subject in our curriculum. There are certain modules on mental stress, civic life, disaster risk management. They should be added in our curriculum. And fifth, you know that mental health is a big area, and recently the government has formulated the ISA strategy, where there are 134 policy pillars and initiatives worked in BISP over the last 5 years. So I was observing that there is discussion on general health, but there is not discussion on mental health. So PIL and other organizations, we should work with the poverty alleviation, social safety division to add certain interventions on mental health, because you know that poor are disproportionately, they have more issues of mental health as compared to the other socioeconomic groups. Sixth, you know that after so we should involve the provinces in policy formulation. Seventh, mental health is highly linked with employment and quality of employment, whatever I have observed in literature. So earlier there was a perception that employment is sufficient for poverty alleviation. But I was looking at the labor force survey data, and I was quite astonished that now, despite of employment, people are poor. So quality of work matters. And if we look our labor force participation, 74% of our employed labor force is working informal. Women are totally absent from the labor force because their participation is just 20%, and that is only limited to agriculture sector. Even there is no enforcement of minimum wage. I was looking at the data that 30% of the graduate women who are employed, they are below the minimum wage. So these are the challenges. Right now we have a good education, especially at university level, where more than 50% enrollment is due to female, but this enrollment is not translated in the labor market. So these are creating this stress. So my last point is that we should, since mental health is disproportionately high among the poor segments, their living is totally the hub of mental stress. So we should think in our growth strategies, in our SDG goals, that how we can create opportunity for the poor. Because right now our approaches to relieve the poor is limited to subsidies, to cash transfers, but we are not creating the opportunities. So these are my thoughts that I consider that they can be added in policy forum. And as being a research economist from PID, I offer my services, and we have MPhil and PhD students. We also offer that we can engage them with you to do more research, and ultimately it will also update the certain data in this field. Thank you.
Thank you so much, Dr. Shujat Farooq. We'll proceed further because we are a bit conscious of time, and we'll move on to the next presentation, which is to be done by Ms. Serish Tawfiq, who is our operational manager at Pakistan Institute of Living and Learning. Ms. Serish Tawfiq.
Thank you, Mr. Amin. So now I will talk about neighborhood determinants of older adult mental health problems in Pakistan. Next slide, please. So neighborhood domain, like it's a key domain of social determinant of mental illness, as it covers area or community that conveys or act as a protective factor from mental illnesses, such as clean water and sanitization, renewable energies, recreational activities, access to healthcare sectors, as well as food safety. These all determinants are the contributing factors towards good health and well-being. So in order to explore that, next slide, Mr. Amin. As you know, we are in the process of doing systematic review. So now we are doing systematic review in order to explore the risk factor as well as the protective factors of mental health of older adults in Pakistan, as well as interventions that are potentially useful to reduce mental disorders or distress among older adults in Pakistan. Next slide, Mr. Amin. So for this, now I'm going the preliminary findings from 3 databases. We screened 81 studies, out of which 3 met our inclusion criteria. Next slide. So our preliminary findings, our first finding is on family system. As we all know, family system plays very important role among mental health, as it acts as a risk factor as well as protective factors. Studies shown that people who live with their family members or in a family system are more resilient and less prone towards death, anxiety, and depressive symptoms as compared to those who live in old care home centers. Our another finding is on role of urbanization. Urbanization promotes nuclear family system, as we all know, which decreases the care and the support which is needed by older adults. And our third finding is on implication of research findings. We all know that research has implications for mental health peoples as well as who are the sufferers. So it has also the positive implications for stakeholders as well, such as care professionals, hospice care workers, and policymakers. Thank you.
Thank you so very much, Ms. Serish Tawfiq. Now I would request Professor Muwaddat Rana to please lead the discussion for this particular domain. Professor Muwaddat Rana.
Thank you very much. 3 important papers. We're still, I think, looking forward to some policy initiatives being discussed on the issues that have been raised so far. We were missing Brigadier Munawar and Major Bas Saab from Alzheimer's Pakistan Rawalpindi chapter, and they've been involved in the process of care of the elderly for decades now. So can we request both of you, sir, to actually contribute towards this aspect and some of the themes that we have covered so far in our talks?
Oh, yes, Dr. Thank you very much. Both of us are here, and we are all here since the morning, listening to all the all the important pearls of wisdom which are there. Yes, a lot has been said, and a lot has been said very well. What we would like to say, and perhaps Nia Basit may like to say, add to this, but our joint views on this subject are as what will come. Basically, what we think is that there's a lack of a scientific approach amongst our families to this problem. And whereas there's a lot of care and intent to care, as you said, and people want to take care of the elders, but the scientific approach is missing. And that is because the interaction between the academia and all the other people and the common people who are going to finally implement them, that is scarce. So whereas our doctors and our caregivers and our higher up people know a lot and have a lot to pass on, but it is not getting down to them. And it is not getting down to them for various reasons. Of course, we don't want to discuss those. But the issue is this, that they are not getting into this scientific approach of caring, which would make their work much more better and which would make the care much more effective. And we can say that one reason for that could be that in our rural areas, a lot of reliance is placed upon other non-scientific approaches like the spiritual approach. कि ठीक हो जाएगा, किसी के पास जाओ, महज दुआ करा लो या दम दुरूद करा लो, इस किस्म का करा लो. So it may become better like this. And they are not aware that there are so many things which can be done through proper schooling of how to take care of the elderly, because we deal with basically caregiving. So that is one thing that we see which is lacking. The other is that we see is that there's a lot of family connections in the country, and people do operate upon joint family systems. That is true, but we also see a breakdown of that, and that breakdown, of course, takes place more in the town communities and less in the rural areas. But even in the rural areas, this is observed, that a lot of breakdowns taking place, because the young people and the young men and the young women, they look outside the village and the community for their livelihood, for their interest, and so on and so forth. And one of the reasons for that is the explosion of this media thing, which is there in everybody's hand now. You know, everybody's connected to the whole world. So therefore, that breakdown is there. So the interests of the younger people or the people at home to be mentally focused on looking after the elders as one of the big purposes of life, or one of the main things of life, that is breaking down, and that has come down, and that they don't have enough time to do that. So as a result, the elders, they suffer. They know they're suffering, and they want to say something, but then that is at the cost of holding down those people from doing their bit. So this is the thing that we see. And of course, on top of that, we do see that the general issue of awareness, you know, which of course covers as an umbrella term the entire thing, that people at home, people who are supposed to look after the elderly as caregivers, they are not aware of the entire thing which is involved in caregiving. It is not simply being socially nice to them, or it is not simply being spiritually nice to them and getting all the sawab in looking after the elders, jaise ki hamare mazhab mein kaha hua hai. It is not as simple as that, although it leads to that. But before that, a lot of finer things have got to be done. It is just like our namaz and prayer and everything. There's a ritual, and we know the ritual, and we do that. But the spirit behind that is a bit different. And that spirit behind that has got to be learned. Even religion has got to be learned on a scientific basis. And when I say scientific basis, it means, for example, Alhamd Sharif, we all recite it so many times a day. But if we do not understand the meaning of each word that is there and where it takes us, that entire spirituality will be lost. So there's got to be a scientific approach in almost everything that we do, including spirituality and including caregiving. So these are the words which I can say, and I think maybe Mia Bharsab, with more experience on this, can add on to this. Thank you, sir.
Thank you very much, sir. Although you've covered almost everything and every aspect, I would just add one thing at the level of consultation by the professional. I always suggest to my friends and doctors and colleagues that never see the patient alone. You must see the patient and the caregiver as one unit, because caregiver is also going through a lot of stress, and he is also suffering from the pressures that the patient would generate on him.
So therefore, the condition of the caregiver has to be assessed at every meeting, because the doctor, the professional will have to administer their treatment through the caregiver. And if the caregiver is not well, the treatment and the management of the patient would suffer. I would like to add this. Thank you very much, sir.
Thank you very much, Mia Basi Saab. Excellent point made. That when you have a patient of dementia in your clinic, there is one sitting next to him or her, and that is a caregiver. We have Mia Atikur Rahman Saab sitting here. So would you like to add to some of these thoughts that we've covered so far? Mia Atikur Rahman Saab?
So he was having some difficulties with his audio settings, so I doubt that he'll be able to speak at the moment. I'm still requesting him.
My very dear Afsha Baji is here. She's been a carer to people that I loved most in my life. And she can give us...
Thank you so much, Mohammed. Thank you so much.
Particularly from a carer's perspective, and in the research that PIL has done on these aspects, could you shed some light, Afsha Baji?
Thank you, Mohammed. Thank you so much. I think it was a blessing for me to be with them. And then, as Bhai also knows, our Nani Amma was with us as well. So, Alhamdulillah, none of them had dementia or memory loss. But one thing which I would like to say, and I would like to tell everybody, yes, sometimes we do feel that they are demanding, and they are repeating the questions again and again, and they are just sort of, I would say, would want apni thodi si attention. Lekin sometimes it is difficult for the carer that if you have got, like your dadi and your nani, and then mashallah your parents there as well, so us waqt thoda mushkil hota hai, lekin it is difficult for the carers. But what I would say that in our country, if we would like, I would say that we are coming in that stage as well, that if we try to unko thoda sa busy kare, if we would try to make them a little bit busy, if we try to not let them be dependent on as soon as it starts, not to be dependent on anybody, and thoda unko nikalne dein, thoda unko logon ke saath baat karne dein, thoda sa, so then they start feeling as well. I want to give example of my daughter-in-law. Mashallah, her father-in-law is 94 years old, and Alhamdulillah, as I would agree with me, Dr. Nusrat would agree with me, that mashallah, he is very busy, because what it is that he has kept himself very busy, and yes, the illness sometimes is there, and with that illness, if the carer tries to go with them on the same direction, and with the approval of what the doctor is giving them the direction, that it helps them a lot. That is just my comment and suggestion. Thank you so much, Mawadda.
Professor Mawaddat, you are mute.
Okay. We're very lucky to have Professor Imran Chaudhary with us. One of the issues with old age caregiving is that every family is looking for a quick fix in form of a syrup, injection, or a pill. Would you throw some light on what are those areas, how are these areas got to be addressed by the families as regards the medical care or so-called provision of medicines in the elderly? Professor Imran Chaudhary.
Professor Imran, I think he lost his connection at the moment. If you could please allow me to move forward, and then we can come back to the discussion. If
Okay.
sir can join. Right. Thank you so much, sir. We'll proceed forward with our next domain on discussion, which will be led by Mr. Majid Sain, Research Assistant at Pakistan Institute of Living and Learning. Mr. Majid, please.
Thank you, Ms. Sami. I'm going to talk about our ongoing systematic review related to environmental determinants of older adults, mental health among Pakistani population. Next slide, please. So what are the environmental factors? These are such as earthquake, conflict and displacement, climate change, droughts or flooding, etc. Also, we are focusing on interventions which have been potentially beneficial for Pakistani older adults. SDG 13 and SDG 16 are related to environmental factors. Next slide, please. Our focused review questions were: what are the environmental events associated with mental health disorder distress conditions in Pakistani older adults? And second one, what type of intervention focused on demographic factors is potentially beneficial to reduce mental health disorder distress condition? Next, please. After running search data among those 44 screening, we could not find any study to fulfill the inclusion-exclusion criteria. Next, please. We have not been able to find any studies till now which are related to environmental variables such as natural hazard, conflict and disasters, earthquake, war, political change or violence, etc. within communities. However, we are hoping to find studies when we search our other databases in which we will focus also on Pakistani specific database, example pakmedi.net. Then it is my request that if any of the participants or our esteemed panelists knows of any study which is related to any of the environmental factors, please let us know. Thank you.
Thank you so much, Majid. I would now request Professor Asad Nizami, Professor of Psychiatry, Chairman, Institute of Psychiatry, Rawalpindi Medical Center. Please, if you could please lead the discussion, sir.
Okay, Bismillahirrahmanirrahim. And thank you, Majid, for the presentation. And I know that Samin is very, very strict with the time, so I will be very brief. First of all, my congratulations to PIL. I think wonderful work they did. They started in 2019 and they carried forward. So a lot of applaud to Professor Naseem, Professor Nusrat, Professor Imran Chaudhry, and Madam Nafsain. See them there, and all the esteemed colleagues there who are there. I just take about 2-3 minutes to update you about a few things. I was following the discussion that had been with the other panelists and with the other people who are discussing. Last week, on the directives of the Prime Minister of Pakistan, the Advisor Health had a meeting in Islamabad, and the meeting was about NCDs and mental health. So this is the first meeting that they held, which was for non-communicable disorders and mental health, which was a separate section. So I think they're drafting the first national action plan. So which means that it's not going to be restricted to only one province. Hussain Jafri informed us that what's happening in Punjab, because the Health Minister of Punjab, Professor Rashmin Rashid, has a lot of interest in dementias, and we do get performers which we send to the health department, which we say how many people have had this difficulty with dementia. So why I'm highlighting this aspect is that this is possibly the right time, because PIL has started the process in a very right manner. Having Mr. Riaz Fatian on board and having an MPA from Sindh on board makes a lot of difference, because they can plug us with this national action plan. Now, coming over to what Majid has just talked about, and as the summit is only for the mental health of elderly, so I'll remain restricted to that. I think he's quoted some of the studies and he's talked about the environmental hazards. I don't know why I'm sure that by the time he was looking into these hazards, COVID wasn't there, or possibly the definition would not include COVID. But he was asking for any studies. So to update on that, I think even before COVID, mental health of the elderly was quite affected by a lot of environmental factors. But during the COVID, I think there's a huge immense of data which is now coming in and getting into publication, because for two reasons. The elderly, when this lockdown happened, were totally locked for two reasons. Because the carers thought that they're potentially at risk of getting a COVID, and because of that, they were extra segregated. So they had no option of moving at all. which has severely affected their mental health. And we've got some preliminary data on that. Now, even while we're slowly, gradually coming down on the COVID and having a second spike, as a healthcare professional, I'm saying that all my colleagues themselves would not go to their elderly parents because they thought that they'll get infected. So I think when we're talking about solutions, we're talking about policy making, we need to look into this aspect that the world is changing very quickly. So now we are going to have the COVID for the next year, and I'll leave it as question to the other panelists and the discussants that if we are to devise something, we should not only be focusing on an earthquake and not only on a war and a conflict zone. We need to concentrate on some of the things which are actually really happening at the moment. So I would want Professor Leroy to talk on that, because I was listening that she's drafted that big roadmap for dementia care services. So when you look at this post-COVID world, how would you take this?
Thank you for calling on me. That's an extremely important and complex question to address. So I think there are two aspects here. On the one hand, we need to address some of the challenges raised by COVID. And I think a large part of that, as you've already mentioned, is about education and understanding. Sorry, did you want to interrupt?
No. I want to get a chance to also speak at the end.
Okay. Understanding and stigma around COVID and the degree to which people can or cannot be cocooned. I think, as you rightly pointed out, one of the big challenges is that people have been protected and cocooned, and this has been, to a certain extent, yes, to save their lives, but on the other hand, the implications have been at the expense of their mental health. Because what we see clinically is that when people come back to the clinic after many months of being cocooned, they have deteriorated significantly in their mental health, their cognitive ability, much more so than we would expect had they been out and about. And of course, increasingly, we're seeing that the risk factors for mental health in older people are such things as isolation, loneliness, depression, sedentary behavior. All these kinds of things simply have been exaggerated by COVID. So that's bringing the issue close to home and saying we've got to solve this through education and awareness of what these risk factors are. So that's kind of the more local COVID kind of issue. But I just wanted to make one comment about the wider environmental issue as well. There isn't a lot of literature about it in Pakistan, but of course these environmental disasters are increasing in frequency because of climate change, worldwide poverty, and a number of other factors. And while there may not be literature in Pakistan, there is a growing literature in some other countries which can be looked at and provide some very interesting guidance. And I particularly point to the literature from Japan, because there's a number of initiatives that have arisen from the result of their very significant environmental disasters, like, for example, the Fukushima disaster, and that disproportionately affected older people because many of them were in care homes. They couldn't be moved easily. Many people hid away from the aftershocks of the earthquakes, and as a result developed difficulties related to sedentary behavior. They also developed difficulties to do with isolation and social isolation when they were removed from their communities in the aftermath. So there's a very interesting and important literature of how the mental health of older people have been affected by disasters such as that. And it'd be worthwhile looking at that to see what lessons can be learned. And again, going back to my point, you're absolutely right. Homegrown solutions are fantastic and many are there. At the same time, don't reinvent the wheel when many people have done this already.
Okay. Thank you, Professor Roy. I think very insightful. And I would add that there are a number of studies which are available in the neighboring countries, because this most of the time when we do not find studies in Pakistan, you do find them from the neighboring countries. I'm talking about the Eastern Mediterranean region, and there I'm sure there are a few studies which can be quoted. Professor Asghar wanted to talk about, so sir, please, if you could share.
Getting quite frustrated and furious that we do have studies. Disaster risk management and older persons. One of the chairpersons of our geography department has written a recent article, published an article on how we go about addressing the needs of vulnerable people in disasters. And that includes older persons. So it's really surprising and frustrating to hear that there is no study in Pakistan. That's one comment. The second comment is you should think about environment in a
जो भी अभी changes कर रही है ना वो आप कर लें और मुझे
Okay, there is a need to think about environment, the word environment, the concept environment in a wider sense, and WHO has been banging on about that environment is not just climate, but it's much more than that. And especially when we're talking about older persons, we need to start talking about age-friendly environment and what factors that include and what studies have been done. And again, we have heaps of studies. In that respect, I will request the researchers not just to take help from electronics and do database searches, but just send an email around to other people who have been doing this work and ask if they know of any study. And they will be surprised how many how much of the gray literature they will come across, and that would help them to find relevant studies. Just one more intervention. Again, we have only last month finished a full report on impact of older persons of COVID-19. And that includes a very hurriedly undertaken a qualitative study as well as a quantitative survey. And that report was released only a couple of weeks ago. So I'm surprised that none of you knew about that report, the impact of COVID-19 on older persons in Pakistan. So it's important that if you just ask around, send us an email, and we will keep you aware of the most recent studies. This report that I'm referring to is SPRC's report, which is the Social Protection Resource Center report, which is on the state of older people's well-being in Pakistan. If you wish, I could send you around that report because I have contributed 2 chapters in it. Thank you.
Okay, thank you, Professor Asghar. And just to add, I think the WHO also has another document which is called as the Mental Health in the Humanitarian Crisis. So in that also they have sections, how do you help the older adults? Another document which is the psychological first aid. I think the institute has had the honor of translating it into Urdu. This also has a section of how do you help the older adults or the elderly population. And as I said that possibly in the definition, I think when we talk about environment, we didn't take into COVID, but if you look into COVID, I think there's a massive amount of material which has come into some in process of getting published, and most had got published. So I think maybe a good guidance, and that's what I asked this in the meeting when this was a collaborative meeting between WHO and the Ministry of National Health Services, that we need to incorporate those aspects now, because once it becomes a national action plan, I think there's very little that you can do later on. So hopefully, I think we will be getting along well with a better national action plan. It will be across the country and will incorporate most of what we are discussing. I don't know, Samin, we have time for more comments, or do we would stop?
No,
So
sir.
before you ask
We'll
me to stop, I'll stop myself. Okay, thank you.
Thank you so much, sir. I'm really thankful to Professor Asghar Zaidi for his comments, and definitely the team will get back to him, and we will make sure that we include all the suggestions that have been suggested by the panel today. We will move forward to Ms. Maria Osman, who is a research assistant at Pakistan Institute of Living and Learning, and Ms. Maria Osman will present her domain of research. Ms. Maria Osman.
Assalamualaikum. My name is Maria Osman. I'm working as a research assistant at Pakistan Institute of Living and Learning. I will be presenting socio-cultural domain for older adult mental health in Pakistan. It's an ongoing systematic review on sustainable developmental goal. Next slide, please. Okay. So as we already discussed, there are 13 SDGs that has proven their impact on mental health of an individual. I will be talking about socio-cultural factor that include SDG number 4, that is and it is linked to SDG number 3, that is good health and well-being in individual. When we talk about socio-cultural factor, there are many elements that come under this domain. As it is mentioned in slide, the elements are like education, social cohesion, social capital, cultural, social class, and so forth. We will be talking about that. Next. When we looked at the questions, there are two questions that we are looking for. One is, what are the social cultural factors associated with mental health disorder, distress condition in Pakistani older adult? And we are also looking at are basically focused on socio-cultural factor for the benefits to reduce mental health disorder, distress condition in older adults in Pakistani population. Next slide, please. We searched 3 databases out of our 6 databases, and these are our preliminary findings. According to that, we screened 107 studies, and we included 9 studies on the basis of abstract. We excluded 6 studies because one was not related to, 2 were not related to socio-cultural factor, 1 was qualitative study, and 3 did not have a clearance on the title and abstract of the study. So we did not included them. According to the preliminary findings, 7 studies showed that social isolation and loneliness are related to increased depression in older adults. And it was also found out that family system act as a moderating role for executive dysfunctions in older adult. One study showed that collectivist culture act as a protective factor within Pakistani population. One study showed that cognitive social capital intervention, that is basically interpersonal trust and reciprocity, act as a decreasing depression and physical disability in older adults. Next slide, please. Thank you. This is from my side.
Thank you so much, very much, Maria. Professor Asad Nizami, I'll request you again to please lead the discussion. Thank you.
Okay, thank you for the presentation. I think a very important pertinent point, because when you talk about the social and the cultural determinants, I think both culture, either you talk about the West and East, have their own parameters and their own merits, how they handle it. But since you're talking about from a Pakistani perspective, it's a blessing that you have your family members who are providing all kinds of care. And I'm sure I would invite Brigadier Munawar and Major Basit to talk a little bit more on it, since they're into the caregiving aspect. And but what is very important again at this time is that I don't know whether when we are looking into this research synthesis, are we looking at what was happening before 22nd of March, before COVID, and now what is happening now? Because my question always remains about here and now. I do understand that most of the research synthesis are being done on studies published earlier. But I would just very humbly suggest that if you were to move forward, we now need to look at it from a very different dimension. We need to look at what is happening now and what's going to happen next. Because if we want to devise a policy strategy, if you want to devise some services, they will have to drastically change a U-turn. Because with the COVID still persisting and its impact there, I think we need to go into strategies which are more feasible, which are more culturally appropriate, which are more acceptable. And one of the most important thing again comes is, what can you do for the normal population, the community? How can you engage them at this time? Because they still have this fear of COVID. They still have their elderly, though the culture, the environment is conducive, but not letting them possibly have a normal daily activity routine. So I would invite Brigadier Rana, Munawar Rana, and Major Basit. You want to say a few things about how do you see when you're working with the caregivers, that how does this culture and social determinants are helpful?
Yeah, I think can you answer first?
Okay, Dr. Thank you very much for affording us this chance. I would mention something slightly different. That is related to the curriculum of the youth. If we are talking about future, we must we must educate our youth who are going to handle the problems of mental health in future. At present, even MBBS students are not exposed to the detail of mental health, particularly Alzheimer's. The primary care services providers, they are not really equipped with the essential knowledge unless the patient is referred to the specialist. Till then, a lot of time is wasted. 2, the curriculum of behavioral sciences and the psychology also doesn't cover adequately the important aspects of mental health. And the third is, I personally believe that even at secondary level in Pakistan studies, maybe you can add some information, some essential information for the youngsters to know the impact of mental health on the society and the families and how to handle that. This is what I would like to suggest as far as the future policy is concerned. Thank you very much. Sir.
And from Brigadier Munawar Rana, you want to add on to something?
This is pretty good what Mia Sahib has said, but it also brings us down to a very larger aspect of the whole issue, and that is the emotional education of our people right from the beginning. We are faced with emotional problems, and we are faced with dealing with emotional problems with other people early on in life, and sometimes we learn these much too late. For example, in my age, we've started learning a few years back how to deal with people who are emotionally disturbed, including people who are in old age and all those people who are also in Alzheimer's, because all these events do overlap one another. Although I do understand medically they're different, but they do overlap. So a lot of our young people at home or anywhere else who go to deal with these issues, they are themselves completely unequipped themselves to face them or even to understand them. So therefore, in our lives, starting very early on, we do have to teach our people how to become emotionally mature in dealing with issues. And the earlier you start, the better, because I do understand youth have got to be impetuous and they've got to be on a action-reaction stuff. We understand that. But a lot of people have got to temper that behavior with a more emotionally mature behavior so they can deal with all these issues before they spoil the case. So it goes down to that, really. So that's our point here.
Thank you. I think they're very valid, because I do understand that the medical students, not even the medical students, even when people are graduating, though it's part of the curriculum with their postgraduate examination, sections on old age psychiatry and elderly, but somehow it remains ignored. So I hope with this National Action Plan going on and the Prime Minister is very enthusiastic about it, we'll be incorporating your suggestions. I think last few comments by Arshad Saab and Sadi, I think they want to share a few bit. So if they're there still, Arshad Saab and Sadi, you want to say a few things?
Thank you, Nizami Saab. I just wish to bring a new perspective in the mental health and older age related discussion. It's a very enlightening discussion for me. Being from Ministry of Health and leading not only Pakistan, but world's second largest social health protection program, catering around 130 million Pakistani population. When I see from the morbidity rate perspective or for my curative healthcare, I'm already very concerned that my cost sustainability or the economic implications for the older population is likely to increase. It should not be unsustainable for the system or for the national economy. But the new dimension I learned from you guys today is very alarming. And I was just thinking in the background how we can add this mental health aspect, especially related to the older age population who are older now. And very well said, my other colleague, the future elders, the youth population, how we can prevent their mental health disorders in days to come. And currently our program is expanding and is likely to expand like NHS of UK in next 3 to 5 years, catering every single Pakistani, at least for the indoor healthcare services. In the health insurance perspective, this mental health is excluded. I was just wondering how we can include this mental health segment to my package or develop another vertical package. I would like to discuss with my boss, Minister of Health. And also a very helpful suggestion I got from Mr. Zaidi, that our LHWs or lady health visitors would also play a part, especially with the older age population counseling on the mental health issues. And maybe, as said by other colleague about the youth, maybe we can engage our teachers, maybe we can engage our ulama karams. This thing has to be tackled at very strategic level. And ASAP, as you very well said, that NCD and Mental Disorder National Action Plan is currently under process at our ministry. And definitely, I would like to bring all those suggestions, which I just heard on this forum, to the top policymakers. And we would like to include, and also we would love to get the holistic document from your side for our review and inclusion in the document. But I'm just putting a question to all the distinguished guests here, how we can include this mental health portion with regard to our social health protection plan, just for my understanding and for our consideration. Thank you.
Okay. Thank you, Akshay Saab. I'm sure your question is pertinent, but I think we're catching with time. But one of the easiest answer is that the EMRO region, the WHO EMRO region, has already drafted a template. And I think that the meeting also they shared with us, we already have it. So they've already gone into all areas of how they're going to look after the elderly population. So I think that would be worthwhile if you look into it. If Samin would allow it, a few comments from Sadia, can we take it, or are you running short of
So
time?
we are short of time, so we have to move on to the next.
Okay, so before you plug us on, plug us off, so we'll possibly go to the next session. Thank you all for participating and for valuable ideas.
I would now request Professor Resma Leroy, Associate Professor of Geriatrics Psychiatry, Trinity College Dublin, to please present her way forward. Professor Resma, the floor is yours, ma'am. Professor Resma?
I just want to share my screen if that's okay.
Okay, I'll just, sure, ma'am. Please go ahead.
You see that?
Yeah.
You see my screen? Yeah? Okay.
Yes.
Good. Sorry, bear with me. I'm just trying to get, there we go. Make this bigger. There we go. Thank you very much. Apologies for the delay. So first of all, thank you very much for the opportunity to speak here for a few minutes. I know we're running out of time, but I just wanted to bring things back to looking at the roadmap for dementia clinical research in Pakistan, which is something we developed as a number of us already back in 2018 and released in 2019. And I thought it would be quite nice to look back to see what have we achieved and where are we right now. And you can see a number of the people on this list are people here today. So I'm just going through very quickly the key headlines and the key recommendations from the roadmap to just highlight some of the things that we've moved forward on. So the first issue that was raised from the roadmap was about raising public awareness and understanding. And I think that's a theme that's come through multiple times today. Now, I think a very important point about this, of course, is that the roadmap knew nothing about COVID-19. It didn't take that into consideration. And so we have a whole new bunch of issues to deal with, which was so rightly pointed out. And I think particularly when in regards to the impact of COVID-19 on older people and the attitudes and the stigma around it and how that's being dealt with needs to be taken in consideration. So it's great to hear that there is a report that has been released about this specific to Pakistan. But COVID aside, there are a number of initiatives which have, of course, come out and are extremely important and are developing momentum. One of them, for example, is the World Alzheimer's Days activities that have been promoted by Alzheimer Pakistan in a fantastic way and really taking momentum and getting high-profile policymakers behind it. And this is from 2019, but the same thing happened in 2020, and having champions moving forward the agenda in terms of understanding and public awareness is absolutely crucial. Other things, for example, research findings about awareness, stigma, understanding at local levels regarding dementia and older people's mental health are absolutely important. And the next step would be to follow up on these reports and take the findings one step further. The other huge issue is about prevention, identification, and reduction of risk. And the focus really has shifted significantly into this area with regards to older adult mental health, even in the last 2 years. Now, most people will be aware of the Lancet report that came out in 2018, and this was led by Jill Livingston. And this has now been updated in 2020, and a number of different risk factors added. And I think the absolute key point here is to recognize the number of risk factors that impact here in Pakistan and the potential for improving older adult mental health by addressing these risk factors. And I'll just go through them very quickly because, well, the point here is that if we address these risk factors, which shouldn't be beyond what we're able to do, then upwards of 56% of dementias might be theoretically preventable in lower and middle income countries. In high income countries, that's about 40%, but actually it has greater impact in high income countries. And these risk factors, which many people will be aware of, which are the 12 risk factors, include lower education, midlife hypertension, obesity and diabetes, alcohol consumption, traumatic brain injury, which is one of the new factors that has been added. And of course, that's a huge issue in Pakistan in terms of the number of people who do not wear head protection on motorbikes. Late life depression, I'm not sure that we know much about that, and the data are missing and need to be improved here in Pakistan. Physical inactivity, a very big issue for older people over the age of 60. Smoking, air quality, again, another new issue. We raised the issue of environmental aspects. Yes, we talked about disasters, but as Professor Zaidi rightly pointed out, there are many other aspects that are, we're facing on a day-to-day basis, and air quality is one of them. And here we do bring in COVID because of social isolation, hearing impairment, and other risk factors. So these are all the things that we need to be thinking about. And one of the ways that we can move forward, and this relates to our most recent speaker talking about the data, is by doing things such as developing a longitudinal study of aging. And a number of us have been working quite hard over the past 6 months to develop the PAC-AGE study, which is the Pakistan Longitudinal Study of Aging, so that we can look over these factors and look for the risk factors for mental health and older adult brain health issues over a period of time. So we're now in the stage where we've developed a protocol, and we're looking for funding to pilot this across the 6 regions in Pakistan. Other initiatives, for example, include the CLICK study. Now, this is a COVID-related initiative in which we have a large-scale global survey of loneliness and social isolation, looking at the impact on care partners of people with dementia. And it's quite a rich data set. So from Pakistan, we have about 1,500 responses, of whom nearly 400 are care partners of people with dementia or long-term illnesses. And we will be starting to analyze these data to try to inform the conversation. And this is in an Urdu and an English version, and we are still soliciting responses up until November 16th. So I think this is, again, a very nice response to some of the highlighted aspects of the roadmap. So moving back to the roadmap, quality of care for people with dementia and their carers, again, this relates back to the CLICK data that we've just been talking about, but many of these things are captured in the National Dementia Strategy, which you've already heard about. And I think we're not quite there, but almost ready for the launch, as I understand it. And when that happens, hopefully that will add to the agenda and feed into the summit as well. The next issue was about delivery of care and services, also about diagnosis, about interventions, both pharmacological and non-pharmacological, and also progression of normal aging. All of these, again, were raised. And I'll just highlight some of the outputs, and there are a few more, but I'm pointing the finger at a few. For example, intervention studies have been the Miracle Study, which is a feasibility study of Montessori intervention for people with dementia, SenseCog Asia, which is a feasibility study of hearing and vision, and a few other examples. But I think the point I want to make here, going back to my very first comment, is that we need to be careful that we're not getting stuck in pilot studies and feasibility. And the key issue is that we move fairly rapidly to implementation studies, because that's the only way that any of these interventions can actually make a difference to people on the ground. So I think I'm going to leave it there, and any comments or suggestions. But I think my final comment is that initiatives such as this summit are absolutely fantastic. and the conversation is moving forward. It's gaining momentum. And I think in terms of looking at the roadmap after 2 years, some significant gains have been made in terms of older adult mental health. Thank you very much.
Thank you very much, Professor Ira. I would now like to request Professor Nusrat Hussain to please end the session by his thank you note. Professor Nusrat Hussain, the floor is yours, sir. Sir, you're on mute, sir.
Yeah. Hi.
Yes. Sir, we can't hear you. If you could
Can
please.
you hear me now?
Yes, sir.
Okay. I would start by thanking our chairs, Professor Muwaddat Rana, Professor Asad Nizami, all the esteemed guests. It's great to meet again after the meeting in Islamabad. I want to briefly say about the process which we are trying to follow, is that we had our launch in March this year. And the plan is to develop a framework, a policy, a strategy by October 2021. That is something we have promised Mr. Riaz Fatiana that we should be able to do it. We have started this process by looking at what are the evidence available from Pakistan. And that is where we are focusing on right now. We would like to get as much information as possible. We are now working with the Professor of Computer Sciences at the University of Manchester, who would be helping us with the text mining. I think text mining people are in Pakistan as well. And they are different 5 streams, life course approach. This area of older adult mental health is making progress. Like Professor Asad said, there are documents from WHO as well, those reports. But it would be great to have the inputs from all of you, and we can work out offline on looking at how we can do this. The young people from PIL who have done a great job by presenting today. One of the things which we are trying to develop is we have limited research capacity and capability that we recognize. And our focus is on building. And these are the youth of tomorrow. These are our succession planning who are going to take this work forward. We are open to working with anybody and everybody because the task is so huge. In just this meeting today, we have found out so much out there in Pakistan we have not been able to capture. So what I'm going to be requesting today is that we continue to keep this momentum. The plan is to meet again early next year. We are hoping that we would have far more information on the next meeting. We would still keep the focus on Pakistan for now. And Ira, you were mentioning about reinventing the wheel. We do not have any intention of reinventing the wheel, but we want to focus on Pakistan first. And our next phase is we would be looking at the global evidence and do all the systematic reviews or update the systematic reviews. And then we want to meet again in summer next year and bring all that together to this, what we call like a working group, and decide what are the things we would want to present in the policy which is aligned with the Sustainable Development Goals and facilitate our journey towards achieving those Sustainable Development Goals. We have got our MPA back, Sidra Imran, so it would be good agar aap, Sidra, if before we finish, if you are able to say a few words.
तानकम जी, अनफॉर्चुनेटली मैं सिंध असेंबली में मौजूद थी, हमारी सेशन के हवाले से एक मीटिंग थी, तो वहाँ पे आपको पता है सिग्नल इश्यूज बहुत ज्यादा कर रहे थे, तो मैं बाहर अब आई हूँ. सॉरी फॉर ज्वाइनिंग यू ऑल लेट. मैं बैक एंड फोर्थ सेशन को सुनती रही हूँ. फर्स्ट ऑफ ऑल मैं पाकिस्तान इंस्टीट्यूट ऑफ लिविंग एंड लर्निंग کا شکریہ ادا کرنا چاہتی ہوں کہ انہوں نے آج اس امپورٹنٹ ایشو پر یہ ڈسکشن رکھی. ہمیں بہت ضرورت ہے اس ایشو پہ وے فارورڈ پلاننگ کی. سندھ کے حوالے سے میں کہنا چاہوں گی کہ پاکستان میں اس وقت میں نے جب لیجسلیٹو ریویو کیا اس ایشو پر تو مجھے پتا چلا کہ 2010 میں جب 18th امینڈمنٹ پاس ہوئی تھی ڈیولیوشن ٹو پروونسز ہوا تھا تو فیڈرل مینٹل ہیلتھ اتھارٹی ڈیوالو ہو گئی تھی پروونسز میں. لیکن اٹس این انفارچونیٹ ٹروتھ کہ کسی بھی صوبے نے اپنی پروونشل مینٹل ہیلتھ اتھارٹی پہ کام نہیں کیا. صرف سندھ نے پھر بھی تھوڑا سا کام کیا کہ انہوں نے ایک بل پاس کیا 2013 میں جو آج تک انیکٹ نہیں ہوا. میجورٹی آف دی لیجسلیشن میں پاکستان میں سب سے بڑی کمی یہ ہے کہ ہم بلس تو بہت اچھے پاس کر دیتے ہیں لیکن ان کی امپلیمنٹیشن, ان کے رولز اینڈ ریگولیشن اور ان کی اوپر جو اسکروٹنی اور اوور سائٹ ہوتی ہے وہ نہیں ہوتی. سیم از دا کیس ود دا لیجسلیٹو پیسز, پالیسی میکنگ تھنگس ریگارڈنگ مینٹل ہیلتھ. پاکستان کی آبادی کا رپورٹڈلی 12% جو آبادی ہے وہ کسی نہ کسی فیز آف مینٹل النس کا شکار ہے اور یہ رپورٹڈ کیسز ہیں. آئی پرسنلی بلیو کہ اس سے کہیں زیادہ پرسنٹیج ہائی ہوگی پاکستان کے اندر مینٹل ہیلتھ ریلیٹڈ چیلنجز کی. تو اس کے اوپر سم سارٹ آف سروے, ڈیٹا مینجمنٹ از آلسو ویری امپورٹنٹ. میں ریکویسٹ کروں گی پل کے فورم سے کہ اگر وہ اس طرح کی کوئی چیز پلان کر سکیں کہ ایٹ لیسٹ اربن ایریاز میں یوتھ سینٹرک مینٹل ہیلتھ کے حوالے سے کوئی سروے کنڈکٹ کیا جائے تاکہ ڈیٹا ہو, بیکاز کوئی بھی پالیسی میکنگ کے لیے ڈیٹا از دا کی. سیکنڈلی اٹ ول بی گریٹ کہ اگر پل کے فورم سے ہم اسٹارٹ کریں لیجسلیٹو ریویو کو کہ تمام صوبوں کے اندر ان کے جو لیجسلیٹو پیسز ہیں, جو لاز اویلیبل ہیں, ان کے اندر کتنی امپلیمنٹیشن ہو رہی ہے اور لیجسلیٹو گیپس کیا ہیں. اگر آپ کو گراؤنڈ پہ کوئی پالیسی امپلیمنٹ کرنی ہے فار دا بیٹرمنٹ آف مینٹل ہیلتھ آف کنٹری, آف سوسائٹی, تو ہمیں لیجسلیٹو ٹولس میں کہاں سے آپ کو کیا ریکوائرمنٹ ہوگی. ایگزامپل کے طور پہ میں ایک چھوٹی سی بات کہوں گی. جیسے صوبہ سندھ کے اندر ہیلتھ ریلیٹڈ تمام جو انسٹیٹیوشنز ہیں ان کی سپرویژن کے لیے سندھ ہیلتھ کیئر کمیشن کا قیام ہوا, لیکن وہ افیکٹولی امپلیمنٹ نہیں ہوا. اس کے اندر انہوں نے ان کے پاس فورم پر ان کے پاس صرف ہاسپٹلس تو ہیں ریویو کرنے کے لیے, لیکن مینٹل ہیلتھ کی جو کلینکس ہیں, ادارے ہیں, اسی طرح جو بلڈ بینکس ہیں وہ ان کے چارٹر میں کور ہی نہیں ہوتے. تو اس طرح کے بہت سارے لیجسلیٹو گیپس آئیڈینٹیفائی کیے جا سکتے ہیں جو ہیلپ آؤٹ کریں گے آگے پالیسی میکنگ اور پالیسی امپلیمنٹیشن پہ, بیکاز پالیسی میکنگ از جسٹ ہاف آف دا ورک. پالیسی کو ایسا بنانا کہ وہ امپلیمنٹ ہو, گراؤنڈ تک اس کے ثمرات کو پہنچایا جائے, دیٹ از اے کی چیلنج ان پاکستان. تو میں بل کا شکریہ بھی ادا کروں گی, ان سے ریکویسٹ بھی کروں گی کہ اس فورم کو کنٹینیو رکھیں اور ڈیٹا مینجمنٹ, سم سروے, سم ڈیٹا سیٹ کا ریویو اور جو پریزنٹیشنز آج یہاں پہ دی گئی ان کو بھی پلیز ضرور پوسٹ کیا جائے ایس ڈی جی کمیٹی کو اور پارلیمنٹیرینز کو, تاکہ یہ جو ڈیٹا, جو پریزنٹیشن ابھی تک جو کام پل کے فورم پہ ہو چکا ہے اس کو لیجسلیٹو فورمز پہ بہتر طور پہ یوز کیا جائے. جیسے کہ میں ریپرزینٹ کرتی ہوں پاکستان تحریک انصاف کو صوبہ سندھ کی اسمبلی میں, تو آئی ایم ٹوٹلی اویلیبل ود دی پل. جہاں بھی آپ سمجھیں کہ میں اسسٹ کر سکتی ہوں, ہیلپ آؤٹ کر سکتی ہوں پل کے فورم کو اس ایشو کو اور پروموٹ کرنے کے لیے, اس پہ کام کرنے کے لیے, لیجسلیٹو انپٹ دینے کے لیے, آئی ایم آلویز اویلیبل ود دی ٹیم ہیئر.
بہت 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 شکریہ, بہت بہت شکریہ. آئی ایم شیور پل کی ٹیم یہاں فرام یونیورسٹی آف مانچسٹر, ہم انشاءاللہ بالکل آپ سے ان کانٹیکٹ ہوں گے. شکریہ ایوری بڈی, بہت تھینک یو ویری مچ. سمین, بیک ٹو یو.
Sir, I'll just like to end by saying thank you to everyone. Professor Naseem, if there's any last words from your side, we'll just end the session. Thank you all.
Again, just a big thank you and big thank you to Hamari MNA, who's been so supportive and huge learning for all of us, including me. I've learned so much from today's session. So bye-bye, everybody.